Hello, my name is Ken Becker. I am the executive director here at Community Crossroads Center, Greenville, North Carolina. We are the only homeless shelter within Pitt County. There is a domestic violence shelter and also a church shelter up in the city of Washington. So there are a couple of other options. But we like to think of ourselves as the professionals and the basically where people would go if they need help. How I wound up here is I'm a retired Marine. I retired in 2008, and I've worked with homeless veterans in the city of Jacksonville for about 5 years, and then that led me to this position here. I've been here since September of last year, and I look forward to doing more of the same. Mm-hmm. Community Crossroads Center. We were established in 1988. We've been here for 33 years now. We are a night-only homeless shelter, which means that we open in the evening around 6 o'clock, and we bring folks in. Give them a hot meal. They're able to take showers, take care of their personal hygiene, get a good night's sleep. And in the morning, we feed them breakfast. And then about 8 o'clock, the shelter closes, and we get it ready for the next night. Mm-hmm. We have done a lot of other programs in the past. Due to COVID, a lot of our volunteer programs are not running right now. But we are able to still keep our residents fed, and our shelter operations have not ever stopped. Mm-hmm. So we were, during the lockdown, we were open 24 hours a day, 7 days a week. We had our staff here. Our residence was open. All of our folks that were staying with us were given a place to stay, and we even provided lunch. So all of our other programs, such as the clothing closet, the respite center, and things like that, we hope to get those back up and running as soon as possible. But let's face it, with children, as a parent myself, if I was going to be homeless, I would be looking for my friends, family, my kids' friends, somebody that they could stay with to maintain some kind of stability. Mm-hmm. For the children. But some people don't have those options. Here at the center, we served about 80 children last year, and that's looking back over the last 5 years. We averaged about 60, so the numbers have crept up a little bit. There again, that's not a true number of how many are homeless here in Pitt County, because we don't know how many are staying with family and whatnot. Based upon the HUD's definition of homeless, somebody that's couch surfing would be considered homeless. So we could say the same thing for children. If they're staying with people who are not their immediate guardians, they would be considered homeless. But as far as what I can tell, we provide a service for those children. They come in with their parents. We don't take any unaccompanied minors, just because of what we are here. We're very congregate housing. We have dorm style sleeping arrangements, so we don't take any unaccompanied minors. We do take minors in our family rooms, and they'll stay with their parents. They'll actually catch the bus for school, stops right outside when school is in session. Since the pandemic, it's been on again, off again for the school systems, as far as what we've seen, whether they be doing virtual learning or in-person learning and whatnot. So, I mean, we're trying very hard to get the family rooms open back up. But there again, that's another one of our programs that we're still working on right now.
Have you, in your experience here, specifically experienced an unaccompanied minor coming to get services. If you haven't, that's okay, but if you have, what do you do after, because you don't,
We haven't had it.
okay.
If there are things in place that if it were to happen, we would of course refer them to the Department of Social Services, Child Protective Services, and things along those in that of that nature to see if we can't get them placed somewhere. Many of the children, I suspect, again, we don't see it here very often, but many of them would prefer to stay out of the system, whether it be the foster care system or any other systems. Most children would like to most people would like to maintain their independence and be able to take care of themselves. One of the things that we see most often here with children is the distrust of the system. They see that, things have broken down and failed in their lives or in their parents' lives. So they totally don't trust the system. So it's hard for them to accept help with no strings attached. We provide services here, and all what we ask is that you follow the rules, and things like not bullying people and not assaulting people and things like that. As long as you follow those rules, we don't ask anything else in return. We don't get paid to do anything as far as getting paid by the residents for any of the service that we provide here. So I think that's the biggest issue with homeless in general, but children in particular.